Greetings and best wishes once again for a very successful IECR conference. And my topic today is evaluating outcomes of diabetic patients treated with drug-eluting stents. And we're focusing on dedicated randomized controlled trials that were conducted in diabetic patient population on coronary interventions. As you can see in the first slide, a comparison has been made between paclitaxel eluting stents and sirolimus eluting stents in the diabetic patient population, and the follow-up period is 10 months and there was a 97.2% yield, and during this period only sirolimus eluting stents were commercially available. This is a result from a very old trial. As you can see, the outcomes were much more significant in favor of paclitaxel eluting stents, particularly all-cause mortality and major adverse cardiovascular events. However, in the subsequent time period, similar head-to-head studies that compared the outcomes of sirolimus eluting stents and paclitaxel eluting stents in the diabetic patient population paints a slightly different picture. It's important that we look at randomized trials that evaluate drug-eluting stents specifically in diabetic patients. The subgroup analysis of registries and randomized trials provide the hypothesis generating findings. However, dedicated randomized trials in specific subgroups such as diabetic patients are ideal to test the findings. I'm going to be looking at 9 randomized trials enrolling over 1,600 patients that have been conducted looking into drug-eluting stents to specifically assess outcomes in diabetic patients. 5 looked at Cypher in comparison with bare metal stents, and my apologies, 4 looked at Cypher in comparison with bare metal stents, and 5 looked at Cypher with paclitaxel eluting Taxus stent. The overview is that Cypher in patients with diabetes, the 9 randomized trials show that there was a significant benefit related to sirolimus eluting stents compared to bare metal stents as well as paclitaxel eluting stents. The studies are ISA diabetes, 250 patients were looked into, Korean RCT, 169 patients, Declare diabetes, 400 patients, Diabetes, 130 patients, and Italian in patients with randomized controlled trial, 60 patients. And all these studies show that there was a significant magnitude benefit related to sirolimus in favor of sirolimus eluting stents compared to paclitaxel eluting stents in the diabetic patient population. The outcome factors that were looked into were late loss findings, as you can see in the next slide. Compared to Taxus, late loss was significantly lower in the Cypher sirolimus eluting stents. Target lesion revascularization, once again, significantly in favor of Cypher stent compared to the Taxus stent. Now let's look at the meta-analysis results of the comparison between sirolimus eluting stent and paclitaxel eluting stents. In relation to re-innovation, you can clearly see that sirolimus eluting stent fared much better comparatively. And summary of late loss is depicted in the next slide, also from the dedicated randomized trials. And once again, if you look at the bare metal stents as well as the comparison with paclitaxel stents, late loss findings were significantly lower with sirolimus eluting stents. So it is clearly evident that if you compare the available stent types in the patient population, which is the diabetic patient population, sirolimus eluting stents have significant benefits when it comes to three outcome measures: late loss, target lesion revascularization, and major adverse cardiovascular events. So in summary, it is evident that if you compare two drug-eluting stents head to head in the diabetic patient population, sirolimus comes ahead of paclitaxel. And more importantly, if you look at the question of drug-eluting stents versus bare metal stents, what is the better choice for my diabetic patients who are undergoing coronary intervention? Hands down, the evidence base support the use of sirolimus eluting stents.